and thank you everyone for joining the Menti and providing your insights, which are very much relevant actually to what Stefan will be presenting and to what also our panelists will be answering today. So now it's time to learn more about our policy brief, which is the highlight of this webinar, where our colleague Stefan will drive you through the key arguments of the policy brief, reflecting the interlinkage between road safety and health from a youth perspective. We'll be able to identify and implement recommendations for safer roads for safer youth using this policy brief and using what Stefan will be presenting and what later on during the webinar, the panelists will be sharing through their insights. So now I give Stefan the floor to drive us through the policy brief. Stefan, you have the floor.
Okay, thank you very much, Mohammed. Can you hear me all?
Yes.
Okay. Thank you very much, Mohammed, for giving me the floor, and hello, everyone. I'm very happy to see all the participation, and I'm very much excited to be here. Well, I am going to present you a short overview of our policy brief, but let's start. We are talking about health, we are talking about well-being, we are talking about transport, we are talking about climate, and you might wonder why we decided to link this topic all together. Well, we decided to do so because recognizing the linkage ensures a more accurate understanding of their combined impact, not only on society, but also on the environment. In addition, we also believe that linking this topic allows for a more holistic and comprehensive policy framework that addresses multiple challenges simultaneously rather than treating them in isolation. And finally, and which I believe is even the most important, writing the policy brief with this topic link ensure that all the recommendations we are proposing are correct and consistent across the different actors, not only government, but also NGOs, youth life organizations, international organizations, and so on. And personally, I believe this is something very important because it allows to minimize the conflict and maximize the effectiveness of the policy. Well, throughout our policy brief, we are presenting, or should I say, we are addressing different arguments. Well, the first argument is related to the burden of road traffic crashes to society and young people. We all know the figures. The recent WHO report shows that road traffic crash killed 1.19 million of people in 2021, and is still the leading cause of death for young people aged between 5 and 29 years. Well, where does it start? It starts from the risk factors, which contribute to the occurrence of the crash and to the severity of the outcome in terms of injury level. And we have several risk factors, for example, speeding, distracted driving, unsafe infrastructure, and so on. So any crash is just a result of the combined effect of one or several risk factors. But then what are the consequences for society? Well, people are dying, which is unacceptable. But in addition, the socioeconomic cost of road traffic crashes is 3% of most country gross domestic product. And for low and middle income countries, it can actually even reach 6% of the GDP, which is a huge financial burden for this country. And at the level of you individual, most of the time, we only think about physical injury, which is fair enough because those can lead to temporary or permanent disability. But in addition, road traffic injuries can also have other consequences on young people. We can think about, for example, anxiety, depression, medical bills, loss of jobs, loss of education, decrease in quality of life. It's actually even worse for low-income family because it can put young people to greater vulnerability because they are more exposed to further safety and health issues. We also address how unsafe road infrastructure impact or foster physical inactivity. Physical inactivity is just one of the 4 main behavioral risk factors of non-communicable disease, responsible for around 800,000 deaths annually. And by physical inactivity, it's just a term used to identify people who do not get the recommended WHO level of regular physical activity. And it's actually the case for a lot of people globally. For instance, 1 out of 4 adults and 4 out of 5 adolescents do not get the recommended WHO level of regular physical activity. And we found evidence that one of the reasons for that is unsafe road infrastructure. Why? Because One of the easiest and convenient way of engaging in physical activity is through active mobility, walking and cycling, which of course is difficult if there are not safe pedestrian and cycling facilities. In another argument, we address how road traffic air pollution impacts the health and safety of young people. Road traffic air pollution essentially comes from vehicle emission, and it contributes to almost 50% of carbon dioxide, which results in premature death. For example, heart disease, cancer, diabetes, and so on. Notably, 1 in 10 child asthma cases is attributed to road traffic air pollution. In addition, air pollution also leads to impaired cognitive function among children, anxiety and depression, and also impaired job productivity among young adults. We also found interesting evidence that road traffic air pollution also impacts the safety because it increases the likelihood of road traffic crash out by reducing the visibility on the road and also by impacting drivers' health, comfort, mood, or cognitive ability. We can also say the same for road traffic noise. In fact, around the world, more than 30% of the population is suffering from exposure to excessive road traffic noise. And this can actually lead to a lot of harmful effects. For instance, health disease, sleep disturbance, high blood pressure, and so on. Among children, exposure to excessive level of road traffic noise can actually create adverse behavior and reduce the academic performances. And among young adults, it actually create fatigue, disturbance, actually reduce their job productivity. Road traffic noise essentially comes from four sources: car noise when we turn the engine, the interaction between car tires and pavement, road rage from driver, and also excessive horn use. We also found evidence that noise can increase the likelihood of road traffic crashes out by influencing driving behavior through driver distraction and also by influencing the cognitive processing of driver through fatigue and aggressive driving behavior. Well, what are we proposing? Safe system, sustainable transport that promote active mobility because they can generate safety, health, and environmental benefit. Let's look at it. With safer road infrastructure, we have reduced road traffic crashes and reduced driving speed. And with speed reduction, it implies reduced noise and air pollution. And of course, if noise reduced and air pollution level reduced, their related harmful effect also decrease. Now, we have safer road, we have reduced speed, and we have lower pollution level. And this can actually then foster active mobility because more people will be willing to engage in walking and cycling. As a result, physical inactivity is going to decrease and its related harmful effect. Now, as more people are going to engage in active mobility, we are going to experience a shift in active mobility that will reduce carbon emissions, vehicle kilometer of travel, as well as pollution. And finally, it is going to catalyze a positive cycle of change. In the policy brief, we propose different recommendations for different actors, but I would like to emphasize on the first one, and we want government and policymakers to prioritize safe and sustainable mobility in urban planning because investing and promoting active mobility not only gives safety benefit, but also health, environmental, and even economic benefit. Of course, we also have recommendation for multilateral agencies to support government and for young individuals to strengthen their skill and initiative. Now, how can young people use this policy brief? Well, I could think about four main points. First of all, learning. By using the policy brief, by reading the policy brief, young people can learn about road safety and the connection between road safety and SDG3. They can share the brief with their peers. You people can also learn about safer road behavior and active mobility, and they can act as role model within the community to be the change they want to envision. And I would like to emphasize on the last point, because in our policy brief, we showcase a lot of interesting road safety solutions that have been proven to be effective. So by learning those case studies, young people can actually use them to develop local action proposals that are aligned with the SDG and the Decade of Action for Road Safety. By using these tools, they can develop those high-skill, high-level proposals and apply to the existing road safety grant, and eventually those launched annually by the Global Youth Coalition for Road Safety. So, if I could just summarize this policy brief in one sentence, is the harmful effect of unsafe road and unsafe vehicles to young people goes beyond road traffic crashes. We also have air pollution, noise pollution, and physical inactivity. This is why we advocate for road safety solution that goes beyond traditional injury prevention and also include safe facility for pedestrian and cycling, because active mobility, there is not only safety benefit, but also environmental and economic benefit. Thank you very much for your keen attention. I think I will give back the floor to Mohammed.
Thank you so much,
Thank-
Steffel. Now, Reem will be introducing our amazing panel so that we can move forward with our very interesting panel discussion. So, Reem, the floor is yours.
Thank you so much, Stefan. So we have three amazing health experts today. So let's introduce them. Dr. Ahmed Shilbaya, a faculty member at Columbia's Millman School of Public Health, teaching global health, and the founder coordinator of the NADA Foundation for Safer Egyptian Roads, focusing on road safety, while also working as a health outcome research scientist for leading pharmaceutical companies. And Dr. Hiba Al-Sawahli, a medical doctor and technical officer in the Non-Communicable Diseases Unit at the WHO Egypt office, and with extensive experience in public health across various areas like school health programs, women's health, HIV/AIDS, disability, NGOs, and she has a passion for hiking and cycling also, so active mobility. Yes, and Dr. Salman Khan, an undergraduate medical intern from India. He currently serves as the liaison officer for public health issues at IFMSA, a prestigious student-run organization representing over 1.5 million medical students worldwide, with special consultative status under ECO-SOC and the non-state actor in official relations with the WHO. So welcome to we are welcoming our three speakers, and we are very happy that you accepted our invitation. And let's start asking Dr. Ahmed. So Mohammed, you can start by asking Dr. Ahmed his question.
Yes, thank you so much, Reem. So, Dr. Ahmed, from your experience, since research and evidence generation is a very important aspect of advocating for road safety and health and youth engagement, etc., what does the research tell us about the increased vulnerability of youth to the negative impacts of road traffic crashes on their health and well-being? And also, it would be amazing to learn more from you about your work with NADA Foundation in engaging youth to address this very important public health issue. So, Dr. Ahmed, the floor is yours.
Thank you, Mohammed. Can you hear me?
Yes, loud and clear.
Yes. Okay. Yes. So, in terms of your first question, the evidence is clear. There's lots of data that was produced throughout the years. And as we always say, the number one killer of youth within the age bracket of 5 all the way to 49, if you take it, in general, are related to safe mobility. Accordingly, if that's not a global security, what is it? The data points to that. If you go towards any source of data or evidence-wise, regional-wise or national-wise, again, looking at the crude death rate in general doesn't give the full picture, but if you again categorize and dissect that along age categories, the story is striking, it's scary, and definitely needs to mobilize the attention of policy decision makers. Of course, unfortunately, decision making at the policy level is not just driven by data. Data is definitely important, but other factors are critical. So you did mention along the discussions the role of youth and the role of advocacy. And I can attest, at least from where I'm working, on a daily basis at Columbia University, and probably many of you have heard some of the news around the role of youth in many of our concerns that are happening globally. The youth are the driving factor for change. And we live actually in a historical moment where youth globally got focused on a specific issue, and they are mobilizing regardless of where they stand in terms of that issue, but at least they are the driving force. And that's exactly, to your second question, what we're focusing on within the NIDA Foundation. It is a youth-focused foundation. It is led by youth. Many of you have met, members of the NIDA Foundation. And we kind of evolved along the years. We've been in the field for the past 10 plus years. And we've evolved to touch upon the specific topic that you all are talking about, the intersection between safe mobility, well-being, public health, and even economic impact on others. I think we've evolved that if we will continue to work in silo in our specific space of safe mobility, the progress will be very limited, and we will not get to the goals that we're trying to achieve. The only way is to lock hands with other causes and mobilize towards achieving several goals at the same time. I'll just end so that I will not take much time from the other wonderful guests. I'm a physician, and in many instances, we've been trained to look at organs in silo. If I'm a cardiologist, I look at the heart. If I'm a respiratory doctor, I look at the lungs, and so on. However, patients do not come with just one morbidity. Patients come with several morbidities. They are diabetic, they are obese, but they also have cardiac problems and so on. And the successful physician or who will manage the disease will look at all of them at the same time. With the same example, also with the issues of road mobility, if we just focus on road mobility without understanding other aspects related to road mobility, and specifically, we've been lately concerned about city design and urban development, and building an environment that tackles to people and not to cars, we will be missing a big opportunity. And I will bring in some examples later on of how the design of our cities in a sprawl manner has impacted not just road safety, but increased the incidence and prevalence of diabetes in children. And the latest even atlas that looks at obesity is expecting within very few years that 250 million children will be obese around the world. So or interrelated.
Yes, thank you very much, Dr. Ahmed, for sharing your insights on this. I have gathered many of these insights in my notes as well, so we'll be covering the reflections at the end of this section. But maybe like reflecting on the NCDs, I guess this brings us to the point for the question from Reem to Dr. Hiba.
Okay, so now we have a question to Dr. Hiba. So our question is, how does the WHO office in Egypt support the NGOs and the civil society, like for example, NIDA Foundation, in promoting road traffic injury prevention for youth, and how does it enable them as agents for change?
So thank you everyone in this wonderful webinar about this very enriching discussion. And I start with acknowledging the efforts of NIDA Foundation, Dr. Ahmed Shelbey, for his long journey with this important topic, especially in Egypt, where we face different topics, different challenges at different layers. Just as he was mentioning right now, the interconnection between the non-communicable disease and road traffic incidents, where youth are going into the center of the vulnerability of both together. Usually we used to look at NCDs as diseases of those who are older or older population, but currently due to the increasing risk factors and exposure to this life of urbanization, the lifestyle of urbanization and industrialization around the world, especially in low middle income countries and countries that want to grow, youth are becoming more vulnerable to non-communicable disease and road traffic injuries as well. So we are looking at youth who face the burden of road traffic incidents, mental health, diabetes, obesity, lack of physical activity, because simply when we talk to people, encourage them to do physical activity to counteract the non-communicable disease, we are struck by the outdated infrastructure, the poor condition of roads, the lack of enforcement of laws as well, and the possible challenges when it comes to behavior change and the accessibility to even very small or very easy interventions, just like helmets. We ask young people to put on helmets, but we don't really ask them what are the challenges. Why are you guys not putting on helmets? So here is where we need most the non-governmental organizations, because we as UN organizations, even government organizations, we have some representation of young people, but still we can't reach out to those who can provide us with the exact and detailed knowledge about the issue, especially when it comes to behavior change. Looking also at the whole topic of urban design and how cities are transforming, we truly appreciate the input from non-governmental organizations in this, because as much as what you were mentioning earlier, Dr. Ahmed, the need for multi-stakeholders and the diversity of inputs we need. UN organizations usually look at their mandate. They try to involve everyone as much as they can, but they don't have this capacity as non-governmental organizations and youth organizations. We need to listen to engineers. We need to listen to those who work simply in delivery, and because those are the people we need to listen to. So as a UN organization working in Egypt, we try to engage with everyone as much as we can. I don't say we were doing lots of progress on the field due to many challenges, but I don't want to make it look less optimistic for you. Because alongside with NADA Foundation and similar organizations that have the same interests, but from other perspective other than health and urban design and any other related aspect to road safety, we can still push the agenda and putting this in the center of youth actions. So putting road safety inside, not just looking at it as an issue of road safety or road traffic injuries, but putting it as a youth problem, it makes it gain more of attention and advocacy efforts. Thank you.
Thank you so much, Dr. Hiba. And now we have a question Dr. Muhammad will ask Dr. Salman.
Yes. Thank you so much for sharing the insights on the role of the WHO and the role of the UN, and of course, the importance of the role of youth. And this brings us to, I would say, the biggest medical student organization, which is the IFMSA. And my question to Dr. Salman would be that we know that IFMSA has developed a policy document on road safety and health. How do you think that we can use this tool together with the yours policy brief that we're launching today to be leveraged as complementary advocacy tools for youth and public health advocates when they get to address such an important public health issue as road safety? So the floor is yours.
Thanks a lot for the question. I hope you can hear me well. The thing is, I'm attending a conference right now, and it got a little crowded, and I'm at the working spot. So yeah, thanks a lot for the question. And your question reminded me of when I connected with Sana 2.5 months back, and we were talking about how we can complement our activities and advocacy efforts for road safety and health. And having this conversation, we thought about the idea of giving inputs and feedback to each other's policy document. And it was a very powerful way of amplifying our advocacy efforts, and we sort of set a very strong example of collaborating and complementing each other's actions instead of competing or working in silos that often happens in many youth organizations. So to begin with, I believe our both the documents can be a one-stop source of information apart from multiple sources available on the open access. And it could also be a beginner's guide to anyone who wants to work on advocacy actions related to road safety and health, or even to build their knowledge, or even refer to a document out of curiosity and sort of understand the connection between road safety, sustainable mobility, as well as health. And medical students have a unique opportunity to educate, advocate, and also contribute to health issues within their communities. And I can personally speak for myself. Road safety and sustainable mobility aren't mentioned to great depth in the medical curriculum. So, using both these documents will sort of complement the already available information in our curriculum as a future healthcare provider. So the documents are not just a one-stop source of information, but also an educational source for even healthcare professionals for that matter. And considering next year is also going to be very important for us as the youth. So, having both the documents used together will help us guide our stances and ensure that our positioning has consistency, especially for the advocacy work that we'll be having leading up to the WHO Global Ministerial Conference on Road Safety, and of course the Youth Assembly for Road Safety, and I can't wait to see the wonders that the Youth Coalition and yours will be working on in the upcoming months for the Ministerial Conference at the Youth Assembly. So yeah, that's from my end, and I hope you could hear me clearly. Apologies if there was any disconnectivity or any background noise.
No worries about that, Dr. Salman. Thank you so much. And now we have extra questions let's start with Dr. Ahmed. So Dr. Ahmed, as a researcher and an active leader and supporter of the youth in civil society spaces, how do you plan to give more exposure to road safety as a public health concern for youth through an evidence-based approach? And is awareness only enough?
A very important question, Reem. I first want to say, I always say to colleagues and to students who are in the global health class that public health is too important to be left for doctors and physicians and public health professionals. I'm a physician, and most of my professional life was dedicated to the health field. However, I do attest that it is extremely important to be left just for this discipline. Interdisciplinary approach of our public health issues are essential. Bringing in experts in urban design, bringing in experts in environment, and many other disciplines. And that's part of the issue of addressing the challenge of safe mobility, is that it is multidisciplinary. And at the end of the day, it needs a strong governance. So to your question, Reem, how we are approaching, again, as I mentioned, youth are the ones that we are addressing, and we're trying to empower. Because at the end of the day, policy decision making, unfortunately, does not have the voice of youth involved. And accordingly, what is built with that unfortunate friction between economic development and public health does not bring in the youth voice. So accordingly, what we do is try to empower youth to have a voice. And to that point, we don't believe that just education is a way that will move the agenda forward or move the needle, as they say. Education is critical when other components are in place. But just education, it has a temporary effect. And I always use that example of smoking. No matter how you advise the smoker that smoking is harmful, they will not quit unless other enforcing variables are in place. And it boils down to the issue of governance, strong governance. It's critical that the youth focus on having a strong governance body that looks at all the variables related to road safety and be introduced and used. So that's the approach that I think would be the most efficient at this stage.
Thank you so much, Dr. Ahmed. And we are very glad that Dr. Maria has joined us right now. So Dr. Maria, we want to welcome her and introduce her before asking her the question. So she's an international consultant and advocate for safe and sustainable global mobility, leveraging her expertise in academia and government to address the consequences of road traffic crashes and improve the population mobility patterns and minimizing negative health outcomes. So welcome, Dr. Maria. We're very happy you joined us. So we just have one question for you for now. How can young leaders use the WHO application to improve the data collection for road safety and health? This is our first question for you.
Oh, the first one is on the application.
Yes.
Let me apologize. Outlook made a mess, and I had this starting 1 hour later. So my apologies. I promise you I was
No
really
worries
ready
about
for
that.
it. So if the application is the first thing you want to know, I hope that by now you all have downloaded the application on your mobile phones. It's called WHO Road Safety Data, no brainer there. Actually, I should, or maybe someone can put a link on the chat. And what you have when you have downloaded the application is the most versatile tool because if you click on more, you actually get a copy of both the latest global status report as well as the 2018 report. So you don't need to carry your PDFs anymore. You have those already on the tip of your fingers. But then in the different other choices in the application, you can do a number of things. Firstly, you can go to the traditional profile approach, selecting any one country that you want, and then checking on all the data that we have for that country in regards some general demographics as well as road safety data. But very importantly, you can compare the data from any one country with that of any other country or any other group of countries. And I think this is particularly valuable as you can create groups on demand. We have tried to simplify your life a bit by creating first a regions application, and you have the countries by WHO region. But as you can see from the top, you can have a My Groups feature where you pick and choose your countries. And you can name that group in whichever way, and you can save it, or you can do as many groups as you need. You have a capacity to personalize up to 5 groups, else you have to delete one and create the one that you want now. And once you create these groups, all the data for these countries will be compared instantly, and the aggregated data aggregated wherever necessary. So I think this becomes very handy when you are in meetings and someone says something like, oh, but in Germany, they don't have speed limits. Okay, because you can immediately check and realize that actually Germany is not a good example. Even for European standards, they are doing much worse than many others. And so you have at the tip of your fingers the evidence that counters lots of the traditional misconceptions on road safety that you face when you talk about these issues with people who pretend to know about the topic. So I don't know how much longer can I go on the application, but my point being, the more that you play with the application, the more uses you can gather on many of we try to make it as user-friendly as possible, but we welcome your ideas for future versions. But wherever you go, for example, on the top right margin, you can find an icon where you could get some graphs produced on the moment, and you could use those graphs for distribution in your social media or your PowerPoints or your lectures. You can have actually the capacity to compare on the spot. So anyway, play with it as much as you can. And I will finish with one comment. As more data become available, we will continue to update the application. And so, for example, in these days, there is going to be an update of the data, and therefore we encourage you to just keep using it, because you'll always have the best and freshest data that we can gather for you. I stop here for now.
Thank you very much, Dr. Maria, for sharing this very important tool. And speaking of this WHO tool as well, this brings us again to our panelists from WHO Egypt. So, Dr. Hiba, as a young person yourself, from your role at the WHO country office in Egypt, what do you think is a sustainable mechanism to engage youth professionals in health spaces to be able to contribute to safe road policies, considering that the health angle is not usually considered in road safety national policies? So yeah, the floor is yours.
Thank you, Mohammed, for this compliment. As a young person, I'm going to give some reflections about this, because the issue with meaningful engagement with young people or anyone is that if we don't allocate money for this engagement, this will not materialize into actions. This might seem like a bit revolutionary if we say, but organizations should take actions to seriously consider the inputs and opinions of young people. So this is basically considering them as partners in driving the change. So when we say that young people pay the price of road traffic accidents, they are the most vulnerable to it, and they pay, and the health system that is not really represented or not put in the focus of road safety interventions at the national level. They pay the price of this problem. So, for example, in some countries, we see road safety is put under emergency department rather than non-communicable disease. So they look at it at the end of the issue rather than from a preventive angle. So it totally depends on the context and the culture of each country and each region. So we need to have this powerful representation of young people in governments, in UN organizations, and in non-governmental organizations as well. So sometimes we perceive our roles as it's very small, it's not really effective, but contributing to data at the level of the community, this is what really means when it comes to interventions at the community level. So most of the time, the government or UN organizations, we look at evidence from the community and we do lack it. So we tend to do rapid assessments or even few focus group discussions with the concerned. But if we have this base of representation of young people at the community level and at the individual level, we could have better understanding of the gaps we have, and also your contribution to something like the application of WHO. This is where you exactly fit in, because you have this energy, you have this possibility to learn. You can stretch your horizons more than us now. So this is where we want your contribution, and also using artificial intelligence more. Sorry about this. So I was just saying young people know technology more, so this was an evidence. So we need this input from young people using artificial intelligence and tools to alert the communities and governments to action they could take to anticipate the problem, not just being at the responsive or coming late at the end of the problem.
Thank you so much, Dr. Hiba, for highlighting the importance, the youth role in the community, and for the use of artificial intelligence. Thank you so much. And now we have a question for Dr. Salman. So from your experience, Dr. Salman, at the IFMSA, how can we give more attention to road safety among youth health professionals?
Thanks a lot for the question. I think the first step for us is to acknowledge that we cannot solve problems when we work in silos. The people from the from a primarily health educational background and people who do not belong to a primary health educational background should work together and should join forces in addressing community challenges, including issues surrounding road safety. Health is indeed the most powerful tool that connects people and connects advocacy movements, and having this having advocacy efforts for road safety with a health angle would get us to achieve I'm not getting the word. I'm getting that word in Hindi, but I'm struggling it to translate in English. But sort of complement our goals and achieve more things together. And since us as youth organizations, we need to also start amping up our capacity development initiatives when it comes to giving key facts, giving digestible information to the youth, making the information youth-friendly, and ensuring that people understand, the complexities behind different resolutions that are discussed in high-level meetings, or different policies that are taking shape on the local and national level. That's when people can translate these, quote unquote, complicated documents and understand what do these documents imply in their daily life and how does that affect their health. That's when they can advocate for change, and that's when youth individuals and also youth-led organizations can make actions at the grassroots level. There are so many wonderful local actions done by individuals and organizations worldwide, and they have received recognition by the Global Youth Coalition every year. And just to give some more examples, us as an IFMSA have been tackling road safety issues through the lens of urban health, rural health, and sustainable cities. And by prioritizing the importance of well-being of residents and the individual and community benefits, and of course the environment benefits that road safety brings along. These are the capacity development initiatives that we have with respect to medical students. And then we also believe in sharing best practices and also sharing our challenges and struggles that us as youth organizations and youth individuals have a unique opportunity to do. We can also educate our peers and community members, which we do through workshops, seminars, and events. And since we also work on first aid and emergency responses, do think that having first aid emergency responses trainings and talking about trauma management and rehabilitation and practicing safety measures, and these are the aspects that we medical students also talk about in our development initiatives. And as medical students, we sort of, not acquainted in a way to talk about preventive measures a lot. And through our initiatives and through also collaborating with other youth-led organizations, we encourage our own medical students and the youth who we collaborate with to be role models for their own peers. I think I spoke a bit too much, and I was
Sorry for
going around
interrupting
in
you.
circles,
You still
yeah.
have 30 seconds to wrap up. Sorry for
Oh, okay,
interrupting you.
okay, that's nice. I'm happy that I have the time. So, being the role model who can sort of be an influencer in their peer circles to, sort of educate them about basic things like wearing a helmet while you're riding a motorbike or a car, or wearing a seatbelt, or not driving under the influence of any drugs or alcohol, not using your cell phone while driving, and how to react and how to help communities in case of a road traffic injury. So these are quite simple conversations that we can have with our peers, and that can lead to a chain reaction of changes. But yeah, I think I'm done with my second.
Thank you so much, Dr. Salman.
Yes, thank you very much for sharing these insights about the role of youth. Just a question to Dr. Maria, how decision makers could open the doors and work in hand with young people to achieve the targets of the global plan? Dr. Maria, you're muted. Dr. Maria, you're muted. Yeah. Yes.
I
Perfect.
thought I had unmuted myself. Sorry. I think that there is no single recipe. The possibilities are as many as decision makers and youth around. My comment relates to how to both create the appetite among decision makers that you have something to say about this, and at the same time, how to avoid youth being utilized by decision makers. It can be a good thing or it could turn into a bad thing. And so my two simple recommendations would be: make sure you are knowledgeable about what you're talking about. I made a sarcastic comment before when I stated that everybody is an expert on road safety, and that's not the case. You don't play that role neither, please. So things like the application, things like being on top of what the literature says, staying in touch with the academicians who do rigorous work on this matter is very important, so that you know what you're talking about, and you can hear and recognize nonsense when you hear it from some decision makers. And I'm very blunt, but I think we need to be blunt here. And once you have your knowledge, then you need to work on your strategy. Approaching the decision making and the decision makers is a very artsy experience. Some will be impressed by evidence, some will be impressed by social skills, but most will be impressed with something that they see is a relatively quick win for them. And so your game is to find how to present safety measures in a way that is palatable and attractive to decision makers. And I will deep a little bit more on this. Most decision makers think road safety is boring and is penalizing. But this is mostly anchored on the fact that they think of safety interventions as policing interventions, prohibiting things from happening. And one challenge you have is to demonstrate decision makers that road safety is much broader than penalizations and much broader than enforcement. It is much richer and much more empowering than that. And so come to the table with positive, effective, and constructive ways that they can understand are not threatening to them. And that is part of the challenge that you have to face. So how will this materialize? It will depend, but stay away from repeating things that are not true. Learn yourselves to dismantle the myths and errors that many decision makers carry around, and do so in a manner that is positive and that makes them see the light, makes them see the fact that there is a lot that they can do to improve mobility, including on safety dimensions of mobility in non-coercive or detractful manners. And last but not least, I also let them know that safety is not as bad as they think it is, because in most countries where population-based representative surveys have taken place, most of the population favors road safety interventions. And so their perceived negativity is in many cases an ill construct of what society demands. And so you have to also know how to best carry that message.
Thank you very much, Dr. Maria, and thanks to all the panelists for all the very important insights. So just like to reflect on some of the insights I have noted down, which are very much, I would say, valuable.
Mohammed, if again, I think the last two questions are very, very important questions. If you would allow me just 60 seconds also to compliment my colleagues on, again, how youth could engage in policy decision making, how people working in the health field, take that into consideration. I think we need to learn also from other causes and what happened and how did they improve their causes and move them along and move the needle. I always use the examples of the HIV community in the 80s, how in a very short period of time, they put the agenda in front of policy decision makers, and they were able to even push the private sector to produce medicines that now HIV is not a death certificate or death penalty, but it's a chronic disease, again, because of the advocacy of the young people at the time, and so on. One important aspect for youth to address the issue of lack of political will towards road safety is to be empowered by others. So one of the issues that we're facing is the lack of public engagement. The public is not engaged in the issue as they should. I come from Egypt, and we all know that people have surrendered the sidewalk without any sort of rebellion, that space is theirs and they need to arrive alive, as it be said. So it's important to empower ourselves as youth with the public and engage them in our issues. How do we engage them? Exactly like Maria said. So we need first between us, those who are concerned and who represent the victims of not just yesterday, but the victims who are coming tomorrow. If we are working in that space, we're now decided that we are advocates for victims who are going to be dying in the next few hours. So we need to understand our issues really well. One of the issues is that we are distracted in the way we frame our issues. Everybody frames the issue in a different way. Everybody frames the solution in a different way. So we need to align on how are we framing our issues so that the outside would take us seriously. The third aspect is coalitions. So your name has a Global Youth Coalition. The term coalition is critical. So we need to have coalitions with others. Standing alone, our voice would be low. People in policy decision makers are very empowered. The negotiation power between very powerful and in individual cause is weak. So coalitions raises the voice. And when the framing is aligned, when there are coalitions and the focus exactly what we need to address, that's where also how we need to have champions, influencers who could take the cause to the front level. Tailoring is also very important, not one size fits all. So in some instances we have to be, with policy decision makers in a negotiating manner. Sometimes we have to object. We have to raise our voices. And that's where some of the tools that have been generated recently, like how can we hold decision makers accountable? Accountability is a very critical component. And not just decision makers for that term, actually multinational organizations. I'm a bit disheartened of how slow some of the multinational organizations are taking the issue. The World Bank has lots of power to influence decision makers. They need to join forces with youth and use their capacity be tailored to influence. Last, reach for the resources locally at the national level, but not just that, but regionally and globally, and use that to your favor. So apologies for the long answer, but I think the past two questions were essential. Dr. Heba, Dr. Salman, and Maria addressed them really well. I just wanted to, put a frame on it that complements everybody's.
Of course, thank you so much, Dr. Ahmed, for adding your very valuable.
Muhammad, your mic is muted.
Yeah, I noticed. Okay, thank you. So I was thanking Dr. Ahmed at the beginning for sharing his insights and also reflecting on everything that has been mentioned. There is lots of data, there is lots of evidence that we can use in our advocacy and in our lobbying to push the work on road safety and health, which we need to do. And we need to couple this evidence with local actions, such as, for example, what's done by civil society, what's done by UN agencies, what's done by all the relevant stakeholders. And this brings us to the interdisciplinary approach that has been mentioned, that everyone should be included and everyone should have this sort of social accountability, that road safety is affecting every one of us and is relevant to every one of us. And that's why we all need to work on it. And that as physicians, as medical students, as just like people who are members of the society, it's very important to link road safety to the different, I would say, public health and non-public health issues that we face in our daily lives, whether the morbidities, whether the non-communicable diseases, whether economic development, whether other determinants, all of these are very much linked to road safety, and we need to work on them. And listening about the cities and the urbanization and the industrialization, this brings us to the concept actually of the SDGs. And when we worked on this policy brief focusing on SDG 3, it's very much important not just to focus on the SDG in a siloed, I would say, or in a vacuum on its own, but link it very much to all the other SDGs and try as much as possible to see how we can tackle the road safety from the different perspectives, and actually use the existing tools, such as, for example, the WHO tool that Dr. Maria mentioned, and use the existing reports and use them as, I would say, a strong, powerful argument when we get to speak to decision makers, and even when we get to speak to the public. When Dr. Ahmed mentioned the importance of the public perception, importance of having a people-centered approach when we get to tackle road safety. And among all of this, what also Dr. Salman, Dr. Hiba were mentioning, the importance of focusing on the different stakeholders, focusing on the different agencies with their different mandates, and putting youth at the center of the work on road safety, because they are impacted by the road safety issues at the moment, and they will still be impacted by it in the future if we do not work on it as soon as possible. I believe this is just like some sort of like summarizing what has been mentioned. Of course, there is a lot more that has been mentioned that is very valuable as well. But also this would bring us to the Q&As where Reem will be coordinating so that we can take some questions from the floor for our amazing panelists. Thank you.
Thank you so much, Mohammed, for wrapping up our roundtable discussion. And now we have some questions, and we want to thank everyone who sent their questions upon registration. So first, to Dr. Maria, Thomas Mayoba from Zambia is asking, could you provide examples of policies or initiatives that have successfully addressed the intersection of transport, well-being, and climate? And what lessons can we learn from them for future implementations?
I started by saying that's not a question I can answer on the spot, because the realities in different localities are different and the intersections are different. And so I'm against the generalization. If something works in one place, it must work in another place. That's not necessarily true. But what I want to do in light of the question is to remind you that it is absolutely legit and needed that you go and shake locally and regionally the UN and government entities who have something to say on this matter. But let's not forget that most of the mobility around the world is actually driven by the business model, the business network that we have. We take our children to school, or they walk on their own or bike on their own, and we drive around because we must get to work and come back from work, or we drive because it is part of our work. And so my suggestion is that as yours, you also approach the employment-based entities and the schooling-based entities that generate so much of the mobility in your localities, because there is a lot they can do to modify, to modulate those needs for mobility and those means for mobility that have a direct impact on the safety of your populations. And so if I would say something in particular answer to the question that I was asked is, well, some of the best things that we have seen relate to, for example, employers promoting and endorsing the use of safety belt among their employees. Some of what we've seen is about schools engaging into remodeling the surroundings and the trajectories of children to go to school. And so let's think, I'm going to say a small, but I don't mean it dismissively. Let's think locally, let's think proximally, let's think about the real motivations for mobility, and let's interact with them, and let's propose small but meaningful interventions to modulate the amount and modulate the means in which we have to move around.
Thank you
I
so
hope
much,
I made
Dr.
sense.
Maria. Thank you so much, Dr. Maria, for answering us. And now we have a question for Dr. Ahmed. So Fofo Adrian from France is asking you about the promotion of electric vehicles as a green alternative to using cars. So from a health perspective and as a representative of civil society organization, what's your view on this?
This is a very interesting space to address. So while, of course, we advocate for less use of fossil fuels through electric vehicles, I think, again, based on the flavor of what we've been discussing throughout this seminar, is that we have society, the world and humanity has wrapped itself around vehicles. Whether these are fossil fueled, electric fueled, we've wrapped ourselves around that. Definitely, it is a step forward to reduce fossil fuel, but what we need to do is reduce the exposure to the hazard, reduce the exposure to vehicles. So in our literature, we use the epidemiological data of number of death, number of people who died on roads, or number of people who are injured, but we forget there are other metrics like the number of miles traveled, number of hours exposed to roads. And that takes us to that topic of how are we designing our cities and forcing our populations to travel long distances and accordingly getting more and more exposed to hazards of the road and the cars. So as much as I am in favor of course, reducing fossil fuel use, but I think we need to look further in terms of reducing our dependency on vehicles. And the other aspect that also needs to be introduced, even us as people who are concerned about this issue, and we've been, many years involved in it, change our angle of how do we perceive space. So, remember that the advent of cars is very, very recent in human history. It's 100 years or 100+ years. Before that, there were no motorized cars. There were other means of transportation. And at that time, space was perceived differently. Space definitely is a place where people move. Transportation is a function of space, but there are many other functions of space. Social gathering, well-being, the topic of this discussion, being out in space, exercising, sitting, enjoying, good breath air, trading, meeting friends at the corner of the street. More and more, space is being defined as a place for transportation, and not even all types of transportation, mechanical, motorized transportation, and we forget that there are other means of transportations like walking, active mobility, and now the new types of transportation means. I'd like just to touch on the past question that remind me, Maria was speaking about which topic I had something to comment about, if possible. Can you remind me? Maria, can you remind me what were you
I was
touching upon?
talking about them not only addressing the government and UN bodies around, but addressing the generators for mobility locally, which
Yes.
tend to
Got
be employers and schools and things like that.
Understood. Yes. So to that question of what are the examples of experiments where there is an intersection between safety, health, and so on. So you would find many, many examples, fortunately, but also unfortunately, in the upper income countries, where societies have started to realize that the intersection of people and place is critical. That's where the impact on health happens. Now they're redesigning cities, taking more and more space for active mobility, bike lanes, walking lanes, furniture in the street that would allow people to sit and enjoy their time. Unfortunately, in low and middle income countries, where 92% of death happens, even though less than 2% of the vehicles are in low middle income countries, that is not yet happening. So the examples are there. And in many instances, when I speak to specifically policy decision makers in low and middle income countries, they say, well, in Egypt, it's Egypt. We're not Sweden. We're not Norway. And I always use that example that actually multinationals in these countries have gone to a stage they have zero crashes, zero death within their companies. Multinationals have standards that are being enforced within countries that lack that system. So it could be successful. And that takes us also to that point of what Maria mentioned, accountability, especially multinational companies, the fast food restaurants around the world where people are driving motorbikes to deliver. They are paid very low, so they're running back and forth very fast, and they're not enforcing helmets and so on. Accountability is a critical point there that needs to be addressed.
Thank you so much, Dr. Ahmed, for your amazing insights. And now for Dr. Heba, we have a question from Shinonyi from Nigeria, is asking if the WHO is planning any sensitization initiatives in Africa on health and road safety.
Oh, thank you for the question. Technically, Egypt lies in the African continent, but it follows the Eastern Mediterranean region in WHO regions. However, I'm a proud African, and I know that WHO is doing lots of technical support, and especially in terms of technical support packages. We have the Save Lives road safety technical package, where WHO work with countries to address issues at the level of governance, legislation, enforcing laws, and working on the supporting the government to work on the infrastructure issues, because the African region has the highest burden of road safety incidents and injuries, and especially pedestrians pay the price for this. So this is a very much needed area where WHO works on, and there are lots of amplifying the voices of the victims. That's what we were mentioning before, giving the voice of those who lost their loved ones in road traffic injuries or became disabled. So this is an area where WHO works on, and also improving rehabilitation services for the victims of road traffic injuries. This is another area where WHO support the countries in. So it mostly revolves about technical support and also enforcing the decade of action for road safety, and also improving data quality that's coming from the Africa region. When we look at the global status report, we have very rich data coming from the African countries. I don't say it's in its best shape, but still it's an area of work that we work on with the countries, in terms of even providing them with the simple data collection methods, or how to update the Excel sheet they have, who they should contact in which municipality, in which department in the government. So we usually help them to come together and sit together and have this sort of agreement about the data and the figures coming out from their countries. So this is a very important role WHO works on and in the African region and around the world.
Thank you so much, Dr. Heba, for your insights. And now we have a question for Dr. Salman. So Kasasa from Uganda is asking you, how can youth encourage the government to put up strict laws against against using unsafe vehicles on the road?
Hi, so I shifted to my mobile phone because we had to leave the venue soon.
No worries
But
about that.
yeah, but when it comes to advocating for these issues and reaching out to the government, let me draw some parallels to like how Dr. Ahmed had mentioned. There's a lot of growing activism and a lot of growing movements surrounding climate justice that the youth have been successfully able to pressure the local governments and even the national governments to adopt some strict policies. So I think it's about time that the us as in the road safety community also joins hands with the youth working in towards climate justice, and which we're already doing, and then sort of amplify each other's advocacy efforts. And when it comes to interacting also with the government, we also need to be mindful of what level are we as the youth being engaged in. Are we just a part of the decision making process as a decoration or a token, or are we being manipulated, or are we just being consulted, or are the decisions that are taking place co-decided by us, or what's the level of our engagement? So this is something that us as the youth need to actively observe, actively question, and actively challenge the barriers to being engaged in the decision making process. And it's easier said than being done, to be very honest. It's a process that takes maybe days, months, and even years for the youth across different communities worldwide to achieve. And that also calls for us as the youth having this safe space for all of us, so we can learn from our own uh, positive experiences, our own challenges, and also offer a safe space for our own like-minded youth individuals whom may face some different challenges. Like, for instance, in some countries, including maybe mine for that matter, youth-led decisions may not be encouraged in a societal view. So, breaking these barriers, actively questioning our communities around, and then, standing up for each other in solidarity are also some things that do count when it comes to reaching out to the government.
Thank you so much, Dr. Salman. And now we want I would like to, moving on, I would like to thank all the participants, Dr. Maria, Dr. Heba, Dr. Salman, and Dr. Ahmed. And for all the joiners, the brief is now ready. So you can now go to the website and download the brief. And we will drop a link now in the chat, so you can directly open the website. You will find it here. Yes, you can scan the QR code or join the link or click on the link in the chat. Sana, just drop the link now. So we want you all to read the brief, and we will be more than happy to answer any questions and tell us what do you think about it.